Oh, look at my babies. They're so cute. I love them. I love dogs. Love dogs. I was born with dogs, and these guys are so cute. Stormy, give me a love. Stormy, give me a love. Yeah. Oh, I love that. Oh.
When you're doing rehabilitation, you're really looking at the whole person. You know, you're looking at not just their physical recovery, but their emotional recovery. You're looking at getting them back, hopefully, to the community at the highest level possible, independently, safely. And that really is the whole person effort. So pet therapy just addresses many levels. It helps on the physical level. You know, you see the patients reaching out to stroke the dog. It stimulates the nerves so that they can feel and increase feeling. Some of the patients have had strokes, and that's really important for them. They also have an emotional benefit. As you can see, the anxiety just goes down. When the dogs come in, smiles go up. And it's just a happy experience for them to be able to really express themselves. And then lastly, certainly not least, is the social benefit. When dogs are present, the people just open up. They start interacting not only with the dog, but also with the staff and the volunteers that are there. And those are all skills that they'll need to use on the outside as well.
There's definitely a level of stress, pain, and emotion that comes along with certain things. Our ability to move, to our mobility. Having the dogs come around really kind of calms you and you know, allows you just to relax a little bit, I think. Gives you that feeling of you know, something to love, something to care for, almost like a teddy bear. They know we need that affection. They know that we're going through an emotional time right now. I believe that, you know. So yeah, definitely, you know.
They come in the room, and I'm just so happy to see them because they, here you are, you're sick, pain, and they come in and they just lift my spirits. It does, it's just darling. They're darling, and I love dogs.
2003, I had a case of meningitis, and I was in the hospital for a week. And the love of my life, Dolly, couldn't come see me. And since she couldn't come see me, I missed her terribly. And so when I got out, I said, what do I have to do? Because if I'm ever back in here, I want my girls with me. So I found out about the pet therapy program at Memorial, got started, and I'm in my 10th year of doing this now. And if I ever have to go back in, this one spends 24/7 with me. So that's how I got into it.
I love it. I mean, she does most of the work, but I really like it. I really like it. You meet a lot of wonderful people, and it feels really nice to cheer up somebody in their hospital bed. You know, a lot of times they'll say, no, I don't want to visit, and then I bring Luna around the corner, and they go, woo, yeah, I want to visit. Yeah, so it sparks up their day, yeah.
Well, after 9/11, I decided I wanted to get into canine search and rescue, and Elska was donated to me to train for that reason. And we serve for the Monterey County Sheriffs and various other search and rescue groups within the Monterey County area for 10 years. And then she's 12 and a half now, so she is now retired. As you can see, she's getting gray hair. And she's now retired, so we've decided to go on to therapy work. And she's actually transferred over quite well, because usually for a therapy dog, you want that rambunctious, nonstop crazy dog. And when it's time to be inside and be mellow, she's inside and she's mellow. And when it's time to do therapy work, she does therapy work really well too. When I wake up and it's time to go do therapy work, I'm so excited about it because I love people and I also love dogs. So I get to do both. I get to be with my dogs and see other dogs, not just my dog, and then also work with people too. It's always kind of been my passion to train dogs to help people. That's always been my kind of motto. And now I get to do that with this. So, and as far as her, she loves it. She looks forward to it. The minute I put her little vest on, or her little scarf on, she looks at me and I say, "You ready to go to work?" And she gets all excited. And she's charging in the door and she's ready to go meet people. And as long as people scratch her right there, she'll stay forever.
Yeah, that's the spot, huh? That's the spot. That's right.
Like that? Yeah, you like that, don't you? Oh, you don't get enough of it at home, huh? As you can probably see now, I'm kind of, upset and a little bit with joy over these dogs coming in. And I can get real teary real quick with just petting them and talking to them in our conversation now. So I really want to pet these dogs to cheer myself up and other people. With this group right here, they will cheer up too, and then they'll talk about these dogs later, how good they were, and the hospital dogs and what they have to go through. So.
There's research been done that blood pressure goes down, the heart rate goes down, breathing stays calm. I have had doctors come down the hallway and say, "Please come see my patient here right now," and the doctor would stand there and go, "Oh, your breathing is better. You seem calmer. How do you like this?" And he's saying, "Oh, I love it. I like it. Please come back." So that just melts your heart, makes you feel good that you're helping in someone's healing process. And then we also hear a lot of personal stories. "Oh, I have 2 dogs at home. I haven't seen them in 2 weeks." And, "Oh, it's so good to see them." And you can see the smile on their faces. And I just get goosebumps when I hear their stories. And I always feel like it's such an awesome way to help the community and help people who are trying to find a way to heal.
It's the doctors that have advocated for pet therapy to be included in their service. Again, it goes by with what Betty Jo had indicated of having a very holistic approach in the healing process that takes place over here at Natividad Medical Center.
As one of our dog handlers was saying, it decreases blood pressure, it decreases stress, it decreases anxiety, helps to, alleviate or decrease depression. And when those things are happening, you're really getting an integrated therapy program, and people can really focus on their whole person recovering, not just their one muscle group or just their heart. It's the whole person that's really recovering with the pet therapy.
There is a certification process, there's a testing process that needs to happen. We also have to clear our volunteers of the requirements. We do have an application packet, safety tests, tuberculosis testing, orientation that needs to happen, and we have them all integrated into the departments and really meet the department before they even commence the service itself.
We spent about 5 months training her to, she had to be trained to be around people in wheelchairs, medical equipment, gurneys, IV poles, and so forth and so on, so that she doesn't freak out when somebody comes by. And obviously she has to know not to jump up on people, and she also has to know, don't get into the food cart.
I helped Tom test at Memorial for probably 8 or 9 years, and he kept telling me, "Your Luna would be a perfect therapy dog." And I thought, I'm not sure about a German Shorthair. You know how they're pretty active. So I took her in, and she passed, and she loves it. As soon as I put her vest and her stuff on, she just calms down. But she is one wild girl. Before we do that, I'm ironing her stuff. She is wooing, running up and down the kitchen. And then she knows to go outside and sit and be calm. So I hook her up. She's good. She loves it. She loves it.
She was kind of scared of people when I first got her. So I thought, how am I going to get her to go up to people if she's scared of them? So I had to walk around with hot dogs around the neighborhood, around the community, and just ask everybody to feed her hot dogs. And that got her to where she liked people. And then I started doing the find refine, where she goes and she finds someone in the woods and she would come to me and bring me to them. as opposed to staying and sitting with the person. And then she would play with the person that she found, and that just made her love people altogether. So she, within maybe, it took me about 8 to 9 months to get her to where she liked people, and now she just loves people. She, as you can see, she comes right up to patients and lets them rub her on the ear. She'll collapse like this and just let them rub her on the belly. And she does really well with both therapy work, and still, even at 12 and a half years old, if I were to send somebody out and get lost in the woods, she would find them. In fact, she's even found my neighbor's dog once. We had to have her look for my neighbor's dog, so she's very smart.
I'm surrounded by 2 beautiful dogs and 2 beautiful spiritual dogs, so I mean, they really tap into your heart, tap into your spirit, you know, definitely do.